Very good evening, everyone. Yeah, good evening. What is the yesterday's session? Anatomy of heart, right? Anatomy of heart. Yeah. Yeah. Arun Abhi Garu, could you please introduce about yourself? Your name and your qualification, your license graduate or not? Are you there, Arun Abhi Garu? Yeah, carry on. Okay. You are non-license graduate. Yeah, sorry. Yeah, okay. You're non-license graduate. You are completed in graduation in, yeah, BTech easy. Thank you. Yeah, same like as Benisha Garu. Could you please introduce yourself? You are from? Okay. Next, Sherina Banu Garu, could you please introduce yourself? Okay, okay. Your license that's you're from? Yeah, okay, thank you. Same likewise, Harsha Kumari Garu, could you please introduce yourself, ma'am? Yeah, you were okay, okay, thank you. Yeah, okay, thank you. Okay, yesterday we are done with cardiovascular system. The cardiovascular system, what is cardio? Cardio ante enti? Heart. Cardio is nothing but heart. Vascular means blood vessels. Vascular means blood vessels. Heart has how many chambers? Four chamber. Heart has four chamber. Heart has how many layers? Layers of the heart has three layers. Heart has four chambers, three layers. What are the three layers of the heart? The pericardium, myocardium, endocardium. Inner endocardium. The four chambers of the heart, upper two chambers are called atria, the lower two chambers are called ventricles. Upper two chambers are called atria and the lower two chambers are called ventricles. Okay, heart has how many chambers? Four chambers. Same likewise, heart has how many septums? Two septum. What are they? Interatrial septum and interventricular septum. Interatrial septum, between the atrium there is a septum is present. There is a septum is called interatrial septum. Between the ventricle there is a septum is present. There is a septum is called interventricular septum. Interventricular septum. Okay, the right atrium was connected by superior and inferior vena cava. Inferior vena cava. The right ventricle was connected by pulmonary artery or vein. Right ventricle, pulmonary artery. Pulmonary artery. Okay. Now the left atrium is connected by pulmonary vein. Pulmonary vein. It's called as pulmonary vein. Now the left ventricle was connected by the largest artery is called aorta. Very good. Aorta. Heart has four valves. What are the heart valves? Yes, tricuspid valve present between three cuspids with the three cuspid. The valve present with the three cuspids between the right atrium and right ventricle is called as tricuspid valve. Which valve? Tricuspid valve. Then between the left atrium and left ventricle, there's a valve is present. There's a valve is called two cuspids తోటి ఒక valve ఉంటుంది bicuspid or mitral valve. The bicuspid is also called mitral valve అంటాం. It is also called as mitral valve. Bicuspid valve is also called as mitral valve. Then between the left ventricle and aorta, there is a valve is present. That the valve is called which valve? Which valve? Aortic valve. Aortic valve. Between the right ventricle and the pulmonary artery, there is a valve is present. There is a valve is called very good pulmonary valve. Heart has heart has heart has three layers, four chambers, two septums, four valves, two septums and four valves. The arteries which supplies oxygenated blood to the heart muscles. Which arteries? Very good. Coronary. If it is kidneys, kidneys means renal artery. Kidneys means renal artery. Likewise, the upper two chambers are called atria, the right atrium and left atrium. The lower two chambers are called ventricles, right ventricle and left ventricle. Heart has two septums. Septums are divided in the chamber. Right between the right atrium and left atrium was separated by interatrial septum. Right ventricle and left ventricle was separated by interventricular septum. Interventricular septum. Heart receives the deoxygenated blood from the veins through the superior and inferior vena cava. Receives what the heart receives? Deoxygenated blood. Okay, CO2 rich blood from the veins. veins ద్వారా superior or inferior vena cava. Body parts నుంచి CO2 rich blood ని దగ్గరకు తెచ్చుకుంటుంది. It receives the CO2 rich blood. The heart receives the CO2 rich blood from the veins through the superior or inferior vena cava. The superior vena cava receives deoxygenated blood from the upper body parts or through the veins. Upper body parts means hands, neck, head. From neck, hand, head. The superior vena cava receives the upper chambers of the CO2. CO2. The CO2 is received from the upper body parts is by superior vena cava. The inferior vena cava receives the deoxygenated blood from the lower side of the body parts. What are the lower side of the body parts? Legs, pelvic cavity, and abdominal cavity. These are all received by inferior vena cava. Okay. Now the heart has four valves. అనేది ఫోర్ వాల్వ్స్ ఉంటాయి. The valves which prevent the backward flow of the blood, backward flow ని prevent చేస్తే they prevent the backward flow of the blood, which was tricuspid valve, bicuspid or mitral valve, pulmonary valve, aortic valve. Tricuspid valve present between ఎక్కడ ఉంటుంది tricuspid? Right atrium and right ventricle. Right atrium and right ventricle. The bicuspid or mitral valve is present between left atrium and left ventricle. Left atrium and left ventricle. Pulmonary valve. The pulmonary valve present between the right ventricle to the pulmonary artery. Right ventricle నుంచి pulmonary artery కి ఉంటుంది. That's the valve is called pulmonary valve. That's the valve is called pulmonary valve. That's the valve is called pulmonary valve. Next, aortic valve. What is the aortic valve? The aortic valve is present between the left ventricle and aorta. Left ventricle and aorta. The left ventricle నుంచి aorta ది మధ్యలో ఉంటుంది. That's the valve is called aortic valve. That's the valve is called aortic valve. These are all the heart valves which prevent the backward flow of the blood. Backward flow of the blood prevents to say. The next today's class, heart has two nodes. What the heart has? Two nodes. It has two nodes. The nodes acts as a natural pacemaker which generates the electrical impulses for the contraction of heart chambers. For the contraction of heart chamber, the nodes acts as a natural pacemaker. The nodes which generate the electrical impulse ni generate చేస్తాయి. The nodes which generate the electrical impulse for the contraction of heart chamber. For the contraction of heart chamber, the heart contains two nodes. Those nodes play a crucial role in rhythmic contraction and relaxation. Contraction is folding inwards is called as contraction. Relaxation. Folding outward is called as relaxation. The heart comes to the normal position. Heart అనేది the normal position లోకి వస్తే that's called as relaxation. Contraction అంటే దగ్గరికి వెళ్ళటం. Okay, folding inside of the heart is called as contraction. For the contraction of the heart, there will be two nodes are helpful. Those nodes are called SA node and AV node. What are the nodes? SA node and AV node. What is meant by SA node? SA node అంటే yeah, very good. The SA node is called sinoatrial node. Sinoatrial node. The SA node is called sinoatrial. Next, AV node. What is AV node? Ventricular node. Atrioventricular node. This nodes which helps in sending the electrical impulses to the entire heart. Okay, when they send the electrical impulse, they receive the electricity from the brain నుంచి electricity receive చేసుకొని this send helps in contraction of heart. See here, the SA node which is present on the right atrium which is present on the right atrium, the SA node which is present on right atrium, it sends the electrical impulses which helps in contraction of atria. Contraction of the SA node which helps in the SA node, sinoatrial node. The sinoatrial node helps in contraction of both atria by sending electrical impulse, which helps in contraction of both atria by sending electrical impulse. Electrical impulse సెన్స్ చేయటం ద్వారా it helps in contraction of atria. ఈ రైట్ ఏటీఎం లో ఏ బ్లడ్ ఉంటుంది? విచ్ బ్లడ్? CO2 rich blood. Superior vena cava, inferior vena cava through the CO2 rich blood is present. In the left atrium, which blood is present through the pulmonary vein? Which blood? Oxygenated blood. Oxygenated blood. Yeah, due to the contraction, దగ్గరికి వెళ్ళటం, folding, the folding of a inward folding of the atria, both atria, right atrium and left atrium folds inside due to the impulse generated by SA node, the contraction of both atria, this is again inward folding causes due to the electrical impulses causes the moving of the deoxygenated blood into the where? Into the left, right ventricle. Oxygenated blood into where? Left ventricle. Right ventricle and left ventricle receives the oxygenated and deoxygenated blood by the contraction. Contraction అంటే దగ్గరికి వెళ్ళటం, folding inward. The folding inward of the both the atria causes the blood moving from the inward. The blood moves from the right atrium, so deoxygenated blood moves to the right ventricle region, and the left atrium deoxygenated blood moves to the left atrium oxygenated blood moves to the left ventricle region. Okay, the blood from the atrium to comes to the ventricles. There is a valves are present. Which valve? Between the right atrium and right ventricle. Which valve? Between the right atrium and right ventricle. Which valve? Tricuspid valve. Between the left atrium and left ventricle. Which valve? Bicuspid valve. Okay, after the bicuspid or mitral valve, after the complete drainage of the blood from the atrium, the electrical impulses are sent to the AV node. From SA node, the electrical impulses sent to the AV node. AV node stores the electrical impulses, helps in entire blood moving into the ventricles. After the moving of the blood into entire ventricles, now the atria was empty, atrium was empty, and the ventricles are filled with the deoxygenated and oxygenated blood. Okay, now the closure of these valves. Which valves? Which valves must and should close? Tricuspid and the closure of tricuspid and bicuspid valves closes. The closure of tricuspid and bicuspid valves closure causes the sound called, what is the sound? Produces a sound called dub. Produces a sound called lub. The lub sound was produced by closure of which valves? Closure of bicuspid and tricuspid valve. The closure of bicuspid and tricuspid valve produces a sound called lub. The sound called as lub. The lub was a sound which was produced by the closure of bicuspid and tricuspid valves. Okay, this is an bicuspid valve. This is an tricuspid valve. The closure of these both valves produces the sound called lub. Now the blood, the CO2 rich blood from the left ventricle, right ventricle to it has to move into pulmonary what? What is it called? Pulmonary artery. What is the valve which is present between the pulmonary artery and the left ventricle? Which valve? The valve is called Pulmonary valve. Which valve? Pulmonary valve. Pulmonary valve. Next, the oxygenated blood is moving into the largest aorta is called the largest aorta. Sorry, the largest artery is called aorta. Okay, the left ventricle, from the left ventricle, the oxygenated blood moves into the aorta. There's a muscles are present. There's a muscles are like Purkinje fibers and bundle of these are muscles which are present in the ventricular region. There are the muscles which are present on the ventricular region, which helps in the contraction of ventricles. Now the caps was closed. Bicuspid and tricuspid valve was closed. Now the contraction of the ventricles, ventricle contraction, ventricles inward movement. Now the blood is moves to where the blood moves. The contraction of right ventricle. The blood moves to where? Pulmonary artery. The blood moves to pulmonary. The CO2 rich blood moves to pulmonary artery. The contraction of yes, yes. The contraction of left ventricle. Left ventricle causes the oxygenated blood moves to where? Where? Aorta. 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 The oxygenated blood moves to aorta. Now the closure of both aortic valve. There is a aorta between the left ventricle and aorta. There is a valve is present. There is a valve is called aortic valve. The closure of aortic valve and the closure of aortic valve and pulmonary valve. The sound is produced. What is the sound? Yes, very good. Aortic valve and pulmonary valve. Aortic valve and pulmonary valve. The sound was produced. The sound called lap dub. The sound was called tap and dub. The sound was called tap. Tricuspid, bicuspid valves close. I say that the sound was produced. What is the sound? The closure of tricuspid and bicuspid valve. Lub. The sound called lub. When a heart beat into the our heart beats like lub dub, lub dub, lub dub. The closure of bicuspid valve and tricuspid valve causes the sound called lub. The closure of aortic valve and pulmonary valve causes the sound called dub. Causes the sound called dub. Lub dub, lub dub. This is a sound which was produced by the heart. The sound which was produced by the heart by the closing of the heart walls. Heart walls close. I think Labdab. We call it as labdab. We call it as labdab. Okay, heart has how many nodes? Heart has how many nodes? Two nodes. What are they? SA node and AV node. What is SA node? Sinoatrial node is called as SA node. Atrioventricular node is called as what is atrioventricular node? Is called as AV node. Atrioventricular node is called AV node. This nodes which produces the electrical impulses which helps in contraction of atria and ventricles. Atria and ventricles contraction can help. SA node, sinoatrial node located in the right atrium, also called as natural pacemaker of the heart. SA node initiates the electrical impulse in atrial contraction. The contraction of atria. The AV node. AV node is also called atrioventricular node located near to the atrial septum. The junction between the atria and ventricles acts as a relay station of full atrial contraction and it sends the electrical impulse to the bundle of his and Purkinje fiber. First AV node sends the electrical impulse to the AV node. AV node stores this energy, stores these electrical impulses and until the drainage of entire oxygenated and deoxygenated blood from the atrium to ventricle. Atrium to ventricles. Atrium నుంచి ventricles కి entire oxygenated blood drainage అయిన దాకా it will wait. After that, it sends the electrical impulse to the Purkinje fibers and bundle of his and Purkinje fibers, which helps in contraction of ventricles. Systole, what is meant by systole? The contraction of heart. దగ్గరికి వెళ్ళటం. The contraction of heart is called as systole. Diastole. Relaxation of heart is called as diastole. Relaxation of heart is called as diastole. Lub. The closure of tricuspid and bicuspid valve produces a sound called lub. Dub. The closure of aortic and pulmonary valve produces a sound called dub. చూద్దాం మళ్ళీ చెప్తున్నాను వినండి ప్లీజ్ లిజన్ కేర్ఫుల్లీ అగైన్ ఐఎమ్ టెల్లింగ్ ఇఫ్ ఇట్ ఈస్ అన్ హార్ట్ is an right atrium is an right ventricle. It is an left atrium. It is an left ventricle. Left ventricle. Left right atrium. Left atrium. Right ventricle. Left ventricle. Between the right atrium and right ventricle, which valve is present? The valve is called tricuspid valve. The valve is called as tricuspid valve. Tricuspid valve. Okay, the valve is called as tricuspid valve. The valve is called as tricuspid valve. Between the left atrium and left ventricle, there is a valve is present. There is a valve is called bicuspid valve. The valve is called as bicuspid bicuspid, bicuspid, bicuspid wall, bicuspid wall, bicuspid wall. Okay, bicuspid and tricuspid valves are present between the left atrium and left ventricle, bicuspid valve. Okay, between the left ventricle and right ventricle and pulmonary artery. Which valve? Pulmonary. The valve is called as pulmonary valve. The valve is called as pulmonary valve. Pulmonary valve. Pulmonary valve. Pulmonary valve. Between the left ventricle and aorta. Aorta. The valve is present. The valve is called as aortic valve. The valve is called as aortic valve. Which one? Aortic valve. Okay, left ventricle and aorta. Between the left ventricle and aorta, there is a valve is present. There's a valve is called aortic valve. Now the SA node is called sinoatrial node, which is present on the right atrium. Right atrium. This right atrium receives the deoxygenated blood from the superior or inferior vena cava. Left atrium receives the which blood? Through the pulmonary vein నుంచి ఏ blood తీసుకుంటుంది left atrium? Oxygenated blood. The left inferior and superior vena cava, the right atrium receives the deoxygenated blood. There's a node is present. There's a node is called which node on the right atrium? SCA node, sinoatrial node, sinoatrial node. Sinoatrial node generates the electrical impulse. Electrical impulse ni generate చేస్తుంది. It helps in contraction of atria. Both atria contraction అవుతుంది. ఈ SA node sends the electrical impulse to the AV node. Which node? AV node. AV node, which is also present on right atrium, near the right atrium. It sends to the AV node. AV node ఏం చేస్తుంది? Contraction of atria, both the entire blood moves to the ventricles. ఎక్కడికి? The right ventricle like A blood also which blood? Which blood? CO2 rich blood. Left ventricle lucky O2 rich blood from the left atrium. From the left atrium. The contraction of both atria. ఈ రెండు ఏట్రియా పైన ఉన్న రెండు ఏట్రియా దగ్గరికి వెళ్తాయి. దగ్గరికి అవ్వటం వల్ల which means folding inward. Both the atria, right atrium and left atrium was contraction causes the blood moving from the right atrium to the deoxygenated blood moves from the right atrium to right ventricle. The oxygenated blood moves from the left atrium to left ventricle. Okay, due to the contraction of atria. After the entire contraction, the electrical impulses is sent to ventricles, Purkinje of fibers, and bundle of ease. Now the closure of which was tricuspid and which was tricuspid and bicuspid. The sound was produced. What is the sound? The sound called lab. The sound called lab. Now the closure of ఉందా వాళ్ళకి రాస్తారేమో అడుగు రాయరంట చదవమంది ఏం చేస్తున్నాం వీడియో అయిపోయిందా ఓకే చదవమని చెప్పాను లేదు నేను వస్తున్నాను యా వెయిట్ ఎ సెకండ్ ఐమ్ కమింగ్ విత్ ఇన్ 2 minutes. Tricuspid. The closure of tricuspid and bicuspid valves causes a sound called the causes a sound called lub. What is the sound? Lub. Next, now that the blood moves from the left to right ventricle to pulmonary artery, right ventricle to pulmonary artery. That oxygenated blood moves from the left ventricle to aorta, left ventricle to aorta. Okay, left ventricle to aorta move అవుతుంది. Now the closure of pulmonary valve and aortic valve. What is the sound is called? The closure of pulmonary valve and aortic valve. Aortic valve is called the producer is called TAP. Is it clear? Is it clear? Lub and up, everybody, everyone. Clear? Yes, kada? Okay then. Okay, మీరు ఎగ్జామ్ రాయొద్దు అనుకుంటున్నారు. ఓకే, ఇఫ్ యూ వాంట్ లీవ్ టుడే. వద్దు రాయొద్దు అనుకుంటే రాయకండి. పేపర్ ఇంటికి తీసుకెళ్ళి రాయండి. బట్ ఈ 2 hours అయితే కొంచెం ఏదైనా బంక్ వచ్చేది చేయండి. ముచ్చట్లు కాకుండా. అర్థమైందా? ఐఎమ్ నాట్ ఫోర్సింగ్ యూ. ఫోర్స్ చేయట్లేదు మీకు. జస్ట్ టెలింగ్ యూ. Okay. Now, yesterday I said please provide the O2 and CO2 charts. No one said in the group. Why so? Yesterday I asked you to share the charts, O2 and CO2 charts. No one shared in the group. Please do it today. Okay. Please share it in the group today. ఓకే, ఫర్ ద బెటర్ అండర్స్టాండ్మెంట్. మీరు ఇంటర్వ్యూకి అటెండ్ అవ్వాలి. ఇంటర్వ్యూయర్ మిమ్మల్ని కార్డియోవాస్కులర్ సిస్టమ్ అడిగితే యూ హావ్ టు టెల్ విత్ గుడ్ కాన్ఫిడెన్స్ తో చెప్పాలి అంటే మీరు రాయాలి. టేక్ ద పేపర్ అండ్ టేక్ ద పెన్. హార్ట్ వాల్వ్స్, హార్ట్ ఛాంబర్స్, హార్ట్ నోడ్స్ అండ్ హార్ట్ లేయర్స్. ఓకే, హార్ట్ సెప్టమ్స్ దిస్ షుడ్ బి రైట్ ఆన్ ద పేపర్. ఒక పేపర్ లో రాసుకోండి. పేపర్ లో రాసుకొని O2 అండ్ CO2 ఎక్కడి నుంచి ఎక్కడికి వెళ్తుంది అనేది మీ దగ్గర నిన్న స్క్రీన్ షాట్ తీసుకోమని చెప్పాను. ఎస్టర్డే ఐ సెడ్ ప్లీజ్ టేక్ ద స్క్రీన్ షాట్. ఓకే, బై వాచింగ్ ద స్క్రీన్ షాట్ యూ అండర్స్టాండ్ ద ఎంటైర్ టాపిక్. అర్థం చేసుకోండి. ఇఫ్ యూ వాంట్ టు లిజన్ అగైన్, లిజన్ ద రికార్డింగ్ సెషన్స్. ఓకే, రికార్డింగ్ సెషన్స్ విని please write it on the paper and please share it on the group lo share cheyandi. Then I will see who is doing the work అనేది. Okay, now please do it today. Yeah, next. I said, see here. Suppose the reaction is formed inside the leg. CO2 from the blood capillaries, veins, inferior vena cava, right atrium, tricuspid wall, right ventricle, pulmonary wall, pulmonary artery, blood capillaries to lungs. Now the exchange of gases CO2 with O2 then leads to pulmonary vein, left atrium, bicuspid wall, left ventricle, aortic wall, aorta, arteries, and body parts. Yesterday I said CO2 and O2 chart. This is the chart. Okay, by watching this also you can write. Next one, coronary arteries. What are the coronary arteries? The arteries which supply blood to the oxygenated blood to the water for the whom? Heart muscles. The arteries which supply oxygenated blood to the heart muscles are called coronary arteries. Next, diseases of cardiovascular system. The diseases of cardiovascular system lo myocarditis. What is myocarditis? Myo means yes, ma'am. Yes. Carry on. Any doubt? Yes. Yes. అర్థం కాలేదు. నిన్న చెప్పాను. నిన్న మీ క్లాస్కి వచ్చారా? వచ్చాను. ఓకే దెన్. ఇది చూడండి. ఓకే, దిస్ ఇస్ అన్ హార్ట్. మీకు స్క్రీన్ కనిపిస్తుందిగా మ్యామ్? ఎస్. యా. విచ్ చాంబర్? వాట్ ఇస్ ద చాంబర్? ఇది రైట్ ఏట్రియం. ఇదేంటి? లెఫ్ట్ ఏట్రియం. ఇదేంటి? రైట్. విచ్ చాంబర్ ఇట్ ఈస్? లెఫ్ట్ వెంట్రికల్. ద రైట్ ఏట్రియం రిసీవ్స్ విచ్ బ్లడ్? ఏ బ్లడ్ ని? CO2 రిచ్. నో, CO2 రిచ్ బ్లడ్ ని ఎక్కడ? ఇదేంటి? సుపీరియర్ వెనకవ. ఇదేంటి? ఇన్ఫీరియర్ సుపీరియర్ వెనకవ. CO2 రిచ్ బ్లడ్ ఎవరు తీసుకొస్తున్నారు? బాడీ పార్ట్స్ నుంచి, లెగ్ సెల్ నుంచి, వీన్స్. ఎవరు? వీన్స్ తీసుకొని వస్తున్నాయి. విచ్ బ్లడ్ ని? CO2 రిచ్ బ్లడ్ ని. విచ్ బ్లడ్ ని? CO2 రిచ్ బ్లడ్. దెన్ ఈ వీన్స్ తీసుకొని వస్తాయి. వీన్స్ యొక్క ఫంక్షన్, వాట్ ఆర్ ద ఫంక్షన్ ఆఫ్ వీన్స్? Veins carries deoxygenated or CO2 rich blood from the body parts to హార్ట్. బాడీ పార్ట్స్ నుంచి హార్ట్ కి తీసుకొని వస్తుంది. నెక్స్ట్ వీన్స్ తీసుకొచ్చిన తర్వాత రైట్ ఏటీఎం లోకి డంప్ చేస్తున్నాయి. రైట్ ఏటీఎం నుంచి ఎక్కడికి వెళ్తుంది? ఈ CO2 రిచ్ బ్లడ్ గోస్ టు రైట్. ఫ్రమ్ రైట్ ఏటీఎం టు ఇట్ గోస్ టు రైట్ రైట్ వెంట్రికల్. దిస్ రైట్ వెంట్రికల్ నుంచి ఎవరు తీసుకువెళ్తున్నారు? లంగ్స్ దగ్గరికి. ఈ CO2 రిచ్ బ్లడ్ ని లంగ్స్ దగ్గరికి ఎవరు తీసుకెళ్తారు? పల్మనరీ వీన్స్ ఆర్ ఆర్టరీ? పల్మనరీ ఆర్టరీ. ఐ సెడ్ పల్మనరీ ఆర్టరీ. పల్మనరీ ఆర్టరీ అని చెప్పాను. ఇట్ ఈస్ అన్ ఎక్సెప్షన్. ఆల్ ద ఆర్టరీస్ అన్ని ఆర్టరీస్ ఏం క్యారీ చేస్తాయి? అసలు అయితే ఏ బ్లడ్ ని క్యారీ చేస్తాయి? ఆక్సిజనేటెడ్ బ్లడ్ ని క్యారీ చేస్తాయి. ఆల్ ద ఆర్టరీస్ క్యారీస్ ఆక్సిజనేటెడ్. వీన్స్ ఏం క్యారీ చేస్తున్నాయి? డిఆక్సినేటెడ్. అన్ని ఆర్టరీస్ ఆక్సినేటెడ్ బ్లడ్ క్యారీ చేస్తే అన్ని వీన్స్ డిఆక్సినేటెడ్ బ్లడ్ ని క్యారీ చేస్తాయి. బట్ ద పల్మనరీ ఎక్సెప్ట్ పల్మనరీ ఆర్టరీ. పల్మనరీ ఆర్టరీ ఏం క్యారీ చేస్తుంది? Deoxygenated blood ని క్యారీ చేస్తుంది. ద పల్మనరీ ఆర్టరీ ఈస్ క్యారింగ్ డిఆక్సినేటెడ్ బ్లడ్. ఇట్ గోస్ టు ద పల్మనరీ ఆర్టరీ. లంగ్స్ ఉంటుంది. లంగ్స్ దగ్గర ఎక్స్చేంజ్ అయిన తర్వాత నౌ ద క్యారియర్ ఆఫ్ O2 క్యారియర్ ఎవరు? పల్మనరీ. లంగ్స్ నుంచి హార్ట్ కి తీసుకొచ్చేది ఎవరు? పల్మనరీ వీన్. వెరీ గుడ్. పల్మనరీ వీన్. ఆల్ ద వీన్స్, వాట్ ద వీన్స్ క్యారింగ్ న్యాచురల్లీ? వీన్స్ ఏం క్యారీ చేస్తున్నాయి? ఇక్కడ బాడీ పార్ట్స్ నుంచి హార్ట్ కి ఏం క్యారీ చేస్తున్నాయి? విచ్ బ్లడ్ ని? ఏ బ్లడ్ ని క్యారీ చేస్తున్నాయి? డిఆక్సినేటెడ్ బ్లడ్ ని క్యారీ చేస్తున్నాయి. ఏ బ్లడ్ ని? వీన్స్ ఏం క్యారీ చేస్తున్నాయి? ఆక్సినేటెడ్ ఆర్ డిఆక్సినేటెడ్ అంటే ఏముంటుంది? డిఆక్సినేటెడ్ అంటే బ్లడ్ లో CO2 ఉంటుంది. ఆల్ ద వీన్స్ ఆర్ క్యారింగ్ deoxygenated blood. All the veins are carrying deoxygenated blood from the body parts of heart. But except pulmonary vein. What the pulmonary vein is carrying? Oxygenated blood. That's why it is an exception. Pulmonary vein నుంచి మళ్ళీ ఈ ఆక్సిజన్ అవసరం లెఫ్ట్ ఏట్రియం లోకి వెళ్తుంది. లెఫ్ట్ ఏట్రియం నుంచి లెఫ్ట్ వెంట్రికల్, it goes to left ventricle. From the left ventricle it goes to aorta. From aorta to the smallest arteries. కిడ్నీస్ కి సప్లై చేసేవి ఏంటి? కిడ్నీకి సప్లై చేసేవి రీనల్ ఆర్టరీ. అదే హార్ట్ కి సప్లై చేసేవి కరోనరీ ఆర్టరీ. ఇస్ ఇట్ క్లియర్ వై దిస్ ఎక్సెప్షన్ వాస్? ఇక్కడ ఆర్టరీస్ ఏం క్యారీ చేస్తున్నాయి? అన్ని ఆర్టరీస్ ఏ బ్లడ్ ని క్యారీ చేస్తున్నాయి? మౌనిక గారు అర్థమవుతుందమ్మా మీకు? ఇక్కడ అన్ని ఆర్టరీస్ ఆక్సిజనేటెడ్ బ్లడ్ క్యారీ చేస్తున్నాయి. ఏం క్యారీ చేస్తున్నాయి? ఆక్సిజనేటెడ్ బ్లడ్ క్యారీ చేస్తాయి. ఎక్సెప్ట్ పల్మనరీ ఆర్టరీ అన్నాను. పల్మనరీ ఆర్టరీ ఏం క్యారీ చేస్తుంది? చూడండి ఇక్కడ ఏ బ్లడ్ ని క్యారీ చేస్తుంది? డిఆక్సినేటెడ్ బ్లడ్. దట్స్ వై ఇట్ ఈస్ అన్ ఎక్సెప్షన్. అంటే అన్ని ఆర్టరీస్ ఆక్సినేటెడ్ బ్లడ్ క్యారీ చేస్తాయి ఎక్సెప్ట్ పల్మనరీ ఆర్టరీ ఒక్కటి మాత్రం ఏం క్యారీ చేస్తుంది? డిఆక్సినేటెడ్. అందుకని అది ఎక్సెప్షన్. సేమ్ లైక్ వైజ్ అన్ని వీన్స్ డిఆక్సినేటెడ్ బ్లడ్ ని క్యారీ చేస్తాయి ఎక్సెప్ట్ పల్మనరీ వెయిన్. ఇస్ ఇట్ క్లియర్? అర్థమైందా? ఓకే. Myocarditis. What is meant by myocarditis? Infection or inflammation of middle layer of the heart is called as myocarditis. Myocarditis is nothing but infection or inflammation of middle layer of the heart is called as myocarditis. Next, angina pectoris or chest pain. What is meant by angina pectoris or chest pain? It occurs due to the low oxygen supplies to the heart. Chest pain. Why the chest pain happens means in the coronary arteries there will be a blockage is present. That the blockage causes the chest pain. Okay. Atherosclerosis. Accumulation of fat in the coronary arteries. Coronary atherosclerosis is nothing but accumulation. Plague is nothing but fat. Fat deposition is called as coronary arteries. Hypertension. What is meant by hypertension? High blood pressure, forced blood pressure against the walls of the blood vessel. What are the normal blood pressure? 120/80. If the pressure on the blood vessels like arteries and veins, if it is 150 by 90 is called as hypertension. What's it called? Hypertension. Hypertension is also called high blood pressure, high BP anta. Next, cardiomyopathy. Pathy ante disease. Myo ante muscles. Cardio ante heart. It is a chronic disease, heart muscle disease. Chronic heart muscle disease is called as cardiomyopathy. Aneurysm. What is meant by aneurysm? Abnormal bulging or swelling of blood vessels like aorta. The abnormal bulging or swelling of the aorta. Bulging of aorta or bulging. Bulging means uppatam. The bulging of aorta is called as aneurysm. Next, coronary artery disease. It is commonly is a vascular disease, accumulation of fat in the coronary arteries, arteriosclerosis. See here, this is an heart. Suppose this is an heart. It is an right atrium, left atrium, right ventricle, and left ventricle. From the left ventricle, the largest artery is called which artery? Aorta. Which blood? Which blood? It supplies oxygenated blood, O2 blood. The arteries which supplies oxygenated blood to the heart muscles. What are they? They are called as coronary arteries. They are called as coronary arteries. Coronary arteries. The coronary arteries supplies the which blood? ఏ బ్లడ్ ని సప్లై చేస్తున్నాయి? O2 రిచ్ బ్లడ్ ని, ఆక్సినేటెడ్ బ్లడ్ ని సప్లై చేస్తున్నాయి హార్ట్ నుంచి హార్ట్ మజిల్స్ కి. ఇక్కడ దెర్ ఇస్ అన్ అక్యుములేషన్ ఆఫ్ ఫ్యాట్ అక్యుములేషన్ ఆర్ ఫ్యాట్ డిపోజిషన్. అవుతుంది. ఫ్యాట్ అక్యుములేషన్ ఆర్ ఫ్యాట్ డిపోజిషన్. ఇంటర్వ్యూ పోయారా? ఫ్యాట్ అక్యుములేషన్ ఆర్ ఫ్యాట్ డిపోజిషన్ అవుతుంది. ఇక్కడ ఫ్యాట్ అక్యుములేషన్ ఆర్ ఫ్యాట్ డిపోజిషన్ అవుతుంది. ఇట్ కాజెస్ ఇట్ ఫ్యాట్ అక్యుములేషన్ ఆర్ ఫ్యాట్ డిపోజిషన్ అయినప్పుడు ఇక్కడ ఏమవుతుంది? ఏ సప్లై అందుతుంది ఇక్కడ? విచ్ సప్లై? స్టాపేజ్ ఆఫ్ విచ్ సప్లై? The oxygenated blood supply to the heart muscles. The stoppage of oxygenated blood supply to the heart muscles. Heart muscles ki oxygenated supply stop avutundi. Oxygenated blood stoppage avvatam valla it causes the condition called, what is the condition is called? This condition, the accumulation of fat is called as CAD antar, coronary artery disease. ఈ అక్యుములేషన్ ఆఫ్ ఫ్యాట్ అవ్వటం వల్ల, ఇక్కడ అక్యుములేషన్ ఆఫ్ ఫ్యాట్ అవ్వటం వల్ల there is a death of the heart muscles. ఆక్సిజన్ అండ్ న్యూట్రియన్స్ లేకుండా హార్ట్ మజిల్ చనిపోతుంటే దట్ కాజెస్ ద చెస్ట్ పెయిన్. ద ఫస్ట్ ఇండికేటింగ్ కాల్డ్ చెస్ట్ పెయిన్ వస్తుంది. ద చెస్ట్ పెయిన్ లీడ్స్ టు మయోకార్డియల్ ఇన్ఫాక్షన్ మీన్స్ డెత్. మయోకార్డియల్ ఇన్ఫాక్షన్. ఓకే, చాలా మందికి హార్ట్ అటాక్ అంటారు, తెలుసు కదా. వాట్ ఈస్ మీన్ బై హార్ట్ అటాక్ ఎలా కాజ్ అవుతుంది? ఈ కరోనరీ ఆర్టరీస్ లో మనం తింటాం కదా ఫ్యాటీ ఆయిలీ ఫుడ్. ఈ ఆయిలీ ఫుడ్ అనేది ఈ కరోనరీ ఆర్టరీస్ లో అక్యుములేషన్ అవుతుంది. ఈ ఆయిల్ అనేది ఫ్యాట్ గా కన్వర్ట్ అయ్యి ఓకే, నాన్ సొల్యూబుల్ ఫ్యాట్ గా కన్వర్ట్ అయ్యి ఇట్ అక్యుములేట్స్ ఆన్ ద కరోనరీ ఆర్టరీ. ఏం డిఫికల్ట్ చేస్తుంది? కరోనరీ ఆర్టరీస్ లో బ్లాకేజ్ క్రియేట్ చేస్తుంది. ఇట్ క్రియేట్ ద బ్లాకేజ్ అండ్ ఇట్ కాజెస్ ద డిఫికల్టీ ఆఫ్ ద సప్లై ఆఫ్ విచ్ బ్లడ్? Supply of oxygenated blood. In this case, the physician performs a surgery called CABG under. What is the surgery? CABG is nothing but coronary artery bypass graft. The physician performs a surgery is called coronary artery bypass graft. We know coronary arteries which supplies oxygenated blood to the heart muscles. Bypass, do you know bypass? Highway కాకుండా bypass route లో వచ్చాము అంటారు. We took the bypass route. That's called as bypass. Bypass is nothing but alternative route. Graft is nothing but grafting. Do you know grafting? Plants grafting చేస్తున్నారు అంటారు. Okay, plant grafting. That's called as grafting. Likewise, the physician removes, okay, by the accumulation of by the damage of entire blood vessel damage and the coronary artery damage, due to the damage of the total blood vessels of a coronary artery, the physician takes the graft from the another artery. Physician takes the another artery from the any side of the body, like femoral artery, any artery from the leg or thighs region. He removes of an artery. He surpasses this route. He creates alternative route for this coronary artery. That's the procedure is called. What's the procedure? CABG. he will insert the he will take the one graft. Okay, ఒక గ్రాఫ్ట్ తీసుకుంటాడు. ఇక్కడ కాళ్ళ దగ్గరికి వెళ్ళి లెగ్ సెల్ దగ్గరికి వెళ్ళి లెగ్ దగ్గరికి వెళ్ళి ఒక గ్రాఫ్ట్ ఒక ఆర్టరీ తీసుకుంటాడు. He will remove the one artery from the leg cell and he implants on the where he implants on the coronary artery. There's a procedure is called what is the procedure is called as coronary artery bypass graft. There is a to supply the oxygenated blood to the heart muscles కి resume చేయడానికి oxygenated blood అనేది resume చేయడానికి he will implant the one graft called coronary artery bypass graft. Is it clear? అర్థమైందా? Everyone, Monica garu, is it clear for you? Rajashri garu? Yes, new joiners. Arun garu, is it clear for you? Venishar garu, is it? Are you able to understand? Yeah, okay then. That is called CABG. Next one. Pericardiocentesis. What is meant by pericardiocentesis? Surgical puncture to remove the fluid from the pericardium. Pericardium is nothing but outer layer of the heart. Valvoplasty. Plasty is nothing but surgical repair. Surgical repair of heart valve is called valvoplasty. Iotopexy. Surgical fixation of aorta. The surgical fixation of aorta is called as iotopexy. And CABG. What is meant by CABG? Coronary artery bypass graft. The coronary artery bypass graft is called as CABG. Is it clear? Is it clear? Yeah, this is about the entire cardiovascular system. Okay, if you have any doubts on the cardiovascular system, now please ask it. Any doubts? Any doubts? Is it clear, everyone? Okay. I already shared the PDF. I already shared the PDF. Everyone received the PDF or not? Yeah, okay then. Okay, please go through with the PDF. And no, you didn't receive it. If you are in the group, yeah, if you are in the group, if you want to ask the Pushpa Garu, she will share with you. And if you are in the group, today I'm again sharing the PDF. Please go through with the PDF. Okay. Yeah. Any doubts? No doubts now? Yeah. Yeah, carry on. Yeah. That's called AV fistula. Arterioventricular fistula, it's called as. Yeah. It is a joint between the both arteries and veins. Yes. Yes. Any other doubts? Any other doubts? Okay, today I again share the PDF. Please go through with the PDF in the group and please make the charts of the make the charts of cardiovascular system and please share it on the group. Today I will check on the group. Okay. Thank you everyone. Tomorrow we will meet. Thank you. Thank you.